Hello students, welcome back to Community Health Nursing. Today we are going to start with a new unit. Unit 3, Health Planning, Policies and Health Problems in India. So in this unit, we will be covering various topics like National Health Planning in India and 5-year plans, various health committees and commissions we will be discussing in this unit, which is related with health and family welfare. Then we have to study two national programs like National Health Policies and National Population Policy in this unit. Then we will be having health problems in India. We have to discuss this topic also. So this unit is of 6 hours total, and all the notes, everything is clearly given in K-Park textbook, what you are having in your hand. In that, page number 905, you all can follow. So let us start with health problems in India today. This is one of the important questions usually frequently asked in university exams, because India is a developing country. So there are so much limitations for us, like in the case of resources. So resources like even money, material, manpower, many resources we are having in limited number. So with the limited resources, how we can tackle the situation? So we know that already resources are limited. The same time, we have so much of health problems also. Like today, let us discuss about some of the health problems, major health problems in India. So before into the health problems, we all should know what is the health situation in India. To know the health situation, we need some data. So from where, how we can analyze this type of data? So one is through morbidity and mortality statistics. As I have told, we have various health indicators which tells us to where the health sector is going in India. So first one is morbidity and mortality statistics will give us a data. Then demographic conditions of the population. So I hope you all remember the unit which you have studied in BSc second year demography. So in that we have seen the various composition of population. So demographic composition. So how much of working category is there? How much of dependent category? Which is a dependent category? Yes, the children and old age belongs to dependent category, and how many are working category, how many old age, how many antenatals, how many postnatal, everything. So then not only that, then regarding this is about composition, then density of population, which area people are more living together, like how much of density is there, the density, that means in 1 square kilometer how many people are living together. So we all know that the urban areas are having more density compared to the rural areas. So like demographic conditions of the population we should know, then only we'll be able to see the health situation. Then environmental conditions which have a main consideration on health. So see, there is a real relationship between environmental conditions and health. So if the environmental conditions are very good and hygienic, and which is very much favorable for a good health and immunity of a person, then of course that particular area all the people will be having good immunity power. So the environmental conditions is one factor. The next factor is socio-economic factors. The socio-economical factors, they also have a direct effect on the health. So if the people are people belongs to a middle class, or those who are having a above socio-economical status, they can afford all the things whatever needed for a balanced diet. But a family who is belong to a BPL family, we cannot tell them that always you should be following the balanced diet, having all the elements into their basic dietary pattern, because sometimes at even rare times they will not be able to afford that. So socio-economical factor of the family is also one of the health situation. Then the cultural background. So the cultural background of the people, so some culture they won't promote non-vegetarian, some culture they never promote having oils, fried things. So it depends. In some culture we all know that there are so much of restrictions, like in some culture they used to tell that the breast milk should not be given for the first 3 days. So there are some myth factors also behind to that. So some of the cultural background and even attitudes and belief. So their attitude, what is their attitude towards health, how they take up the things, what is their knowledge level, what they really believe and they practice in their society. So these all will affect the health. Not only this, the medical and health services available. If there is a good availability or a good approach of health and medical services in a particular area, the health situation of that area also will be very much improved. So these are the various data required for analyzing the health situation. So by keeping in this in our mind, let us discuss about some of the health problems in India. So when we divide the various health problems in India, we can divide it in common as communicable disease problems, non-communicable diseases, nutritional problems, environmental sanitation problems, medical care problems, and population problems. So totally don't think that these are the only problems in India. These are the highlighting health problems in India. So let us discuss one by one. First one is communicable health problems. So in communicable health problems, we all know that India is taking much effort to prevent all the communicable diseases, especially through vaccination. So they focus really on immunization a lot. The maximum coverage, that is 100% coverage of immunization, is being entertained by the government with free of cost through all the public sectors. So in the last unit we have studied about the various health sectors. So like all the sectors, like starting from sub-center, PHC, CHC, all the district hospital, rural hospitals, medical college, everywhere the vaccination is 100% free of cost, so that all the children should be immunized against communicable disease. Because there is the vaccination is the only thing we can mainly do against all communicable diseases. So some of the diseases prevalent in India are discussed here, like malaria. We all know that till now we are not able to eradicate malaria, tuberculosis, these issues from our country. So malaria, tuberculosis, then diarrheal diseases. Diarrheal diseases and acute respiratory infection, these two are especially affected to children because they are more prone to get this diarrheal problems and acute respiratory infection. Even this both two are, if not treated at the right time, even it can lead to death of the child also. So diarrheal diseases and acute respiratory infection should be taken care in a much serious manner among the children. Then we have leprosy, filaria. So even leprosy and filaria is also filaria we have a much control more than a leprosy, but still leprosy is still one of the problem which we can see in our country. So these all communicable diseases, maximum of them, they are having vaccination. The only thing is the people should be aware that, like nowadays the generation, like your generation and the upcoming generation, they are more aware about the vaccination. But just think about your parents. Maybe your parents also have took vaccinations, many of them, but their parents, that means your grandparents, many of them, they were not aware about this vaccination. Many of them have not followed that vaccinations. So this is how generation to generation, the only thing, because the population is increasing like anything, even the pollutants around us is more, environmental changes are happening, so the spread of communicable diseases are getting very faster than earlier days. So nowadays, in order to prevent this communicable disease, we all have to get the vaccination and a good lifestyle, having protecting ourselves from all these infections by increasing the immunity power of us. Then we have other problems also, like we have AIDS problem also, acquired immunodeficiency syndrome. So even in all the countries, we can see a rising factor as AIDS. So this also should be considered as a communicable disease problem in India. Not only this, we have other minute issues like Kala Azar problems, meningitis, viral hepatitis. So there are so much. That's what I told. Don't think that only these are the communicable diseases. These are the only communicable diseases which are more prevalent in India. Next is regarding non-communicable diseases. I hope we all know what is non-communicable disease. So the main non-communicable diseases in India is like diabetes mellitus. We have cardiovascular diseases, cancer, stroke, cataract problems, lung diseases, oral health issues. See, there are the same way. The trend nowadays, it is going like communicable, more than communicable disease. We have a high trend of non-communicable diseases in India because it is one of the raising burden of chronic diseases, especially in the aging category or when we are moving into the early adulthood, like above 40s. Nowadays, even above 30, 35 onwards, we are able to see all the non-communicable disease. So one of the reason is overweight. Like we all know that cardiovascular diseases, hypertension, diabetes mellitus, these all are only because of the lifestyle. We cannot tell only because of, but around 80% is because of the lifestyle, and 20% we can tell about the hereditary factors also. The lifestyle, whatever the people were following earlier, the same thing they are following, but the physical activities have a lot of change. Like previously, when we take the example of our grandparents, they used to have all the food whatever we eat, but they work very hard in the field, so they sweat every day. They waste their energy, their calorie whatever they are taking, they used to spend on the same day. But nowadays the food style has been changed. We have more increased with other stuffs like fried things, bakery things, everything, but the physical activity has a wide reduction. So we used to sit somewhere, we used to sit under the fan, everybody is educated, so the working culture has changed. Nowadays agriculture and farming has been done only by very few people. So these type of things really lead to all this non-communicable diseases. So like some of the causes we can list down is, one is aging population. In India we have much number of aging population. They are getting a good lifespan. Then environmental driven changes in behavior, as I have told, the lifestyle, the behavioral patterns, like even for example we can tell the overuse of alcohol, the overuse of tobacco products, smoking, all this can really lead to a bad lifestyle, which is very much having a problematic issue for the non-communicable diseases. So these all things you have to keep in mind when you are taking care of a non-communicable disease. Not only these things, like other causes like lack of equipment and machinery materials. We all know about our health sector. The health service, in India is having its own limitations because we are a developing country. So we don't have much infrastructure, or we don't have a very good infrastructure in our health services in India. So some of the things like lack of equipments, lack of machineries, and some the poor maintenance of all these equipments, these all can lead to some problems, or these all can lead to a hint in order to increase the non-communicable diseases. Because in non-communicable disease they really need a health service in the sense they all need the follow-up care. So for that non-communicable disease they really need a good health infrastructure, which is a lagging factor in India. So this is about the non-communicable diseases. The next problem in India is nutritional problem. As we all know, nutritional problem is also having a major share in health problems, because we have many states which is poor performing. So the poor performing states really they are having some of the factors which is directly influence over the nutrition of the people. So we have nutritional problems like protein energy malnutrition. You have already studied it, like kwashiorkor, marasmus. So protein energy malnutrition is one of the major problem we can see in the low performing states. And nutritional anemia is one of the factor in much more states we are able to see. especially among adolescents and even among the early mothers. So like mothers, those who are age of, even those who are nearing to the anemia, nearing to menopause, they all used to have this anemic status. Then they have low birth weight. Like low birth weight is one of the problem among the newly born children. It is also can be taken as one of the nutritional problem in India, because if the mother is not getting proper diet or proper nutritious diet during the pregnancy, they will of course have the anemic state in their pregnancy period. So it can really affect a low birth weight baby. Then xerophthalmia, like we can call it otherwise as nutritional blindness. It is also one of the issue in India, because many of the area they don't give much importance for the consumption of vitamin A, which can really cause a temporary or permanent blindness. So this should be taken care. And not only this, we have various other nutritional issues like iodine deficiency disorders we have, then fluoride problems. So it depends upon the area, or it depends upon the high altitude areas, because we all know the geography of India. So we have coastal lines, we have various hilly areas. So each of the geographical area, they have their own problems also, which is related to nutrition. So these all are some of the nutritional problems which we can see in India. The next one is environmental sanitation. Environmental sanitation is also one of the major factor which can really cause various health issues, or it is one of the main cause of various health issues happening in India. So because of that, because of various environmental sanitation, what we are facing is the lack of safe drinking water. It is one of the major issue in India. Even till now, we in India, we don't have a good source of drinking water everywhere. Then excreta disposal problems. So we have so much of problems in waste disposal methods. We don't have a proper recycling of waste. So many of the areas till now, even dumping is happening. We don't have a proper recycling of waste materials, and even we are following the traditional excreta disposal methods only. We are not thinking about something new. So these are some of the hindering factors. So ultimately these all will lead to air pollution, water pollution, soil pollution, and even food pollution. So it all will ultimately lead to a bad health. So as I have told, population explosion is one of the main reason for all these environmental problems, and even urbanization and industrialization. A fast development is happening in one side with more industries, more factories, but at the same time we lag with various infrastructures and basic elements like proper waste disposal system, and we don't have a good environmental sanitation, or in order to maintain the quality of air, we don't have a quality index even for the air, water, soil, all those things. So ultimately when soil is polluted, what we eat, what is we are eating, all the agricultural products, even that is also getting polluted because of the overuse of fertilizers, pesticides, all those things we use in double. Why? Because we need double production, because we have much population also, population explosion also. This is why in community we always focus upon family planning or small family norm. The next problem is medical care problems. As we all know, in India, we have around 80% of health services, they really concentrate into the urban area. So our rural area is even very much weaker than the urban side. Even the distribution of doctors, it has an uneven pattern. So doctors also mostly they would like to work into the urban area. So very less concentration is given towards the rural and tribal areas. This is why we can see government is maximum trying to upgrade the sub centers and PHCs. Even we can see the tribal and hilly area, they give much concentration by decreasing the number of population coverage for each sub center and PHC. But still we have these issues, and migration is one of the other cause. Like people usually they migrate towards the urban side. So in rural area we can see less density of population, but there there even the medical facilities are also very rare. So if they want a real medical attention in an emergency condition, they have to travel a long way, and they have to come out from the rural area where they don't have a proper transportation system also. Then inadequate staffing is also one of the problem. Not only doctors, staff nurses, technicians, so we can see an inadequate staffing among the public sectors. Then scarcity of essential drugs. So various emergency drugs or the first line treatment, sometimes we face a scarcity because, as I have told, the supply, equipments, the money, these all matters in India since it is a developing country. The unequal distribution of health resources between urban and rural is one of the main factor of medical care problems. In urban we have even private sectors also. Even the private sectors also, they focus on urban sector. Why? Because there only more population is there, and which they will be able to get all these things. Then the next problem is a lack of penetration of various health services to the social periphery, as I have told. Towards the periphery area, we have a very less penetration of health services. Maximum of the health services are concentrated into the urban areas where the density of population is much more. The next one is population problems. As we all know, all these problems, the underlying, the basic root cause is population explosion. So if we reduce the population, then we will be having enough resources, we have enough food resources, we will get a very good quality air, quality soil, quality water, everything. So that's what Indian government is trying much for the family planning methods. Then this population problems, it will lead to lack of employment, it will lead to lack of education and various housing problems, and even the healthcare issues and sanitation, environmental issues. These all happen because when population is increasing, ultimately waste is also increasing. The excreta disposal methods, everything we have to rethink about it. So the lack of family planning, which can lead to all this population explosion issues. So we should much focus upon the 2-child family norm. We have to motivate the whole population. So it is the role of our community health nurse in order to focus more on the 2-family norm, and we should motivate all couples to take up this 2-child family norm. And even because of all this population issues, we used to see a delay in economic development also. So we have more population and we have less resources or limited resources, so it will of course lead to a delayed economical development. So these are the various population problems. So now let us see the basic resources for better health care. So in order to have a better health care, what basic resources we should more have? The 3 things what we really need is health manpower, money and material, and time. So health manpower, when we are telling about even the professional and auxiliary health personals. So the various professional bodies, like we can tell it as like doctors, nurses, we all work in the health sector. So still we have a lack of resource in health manpower. The next one is money and material. So we are a developing country and we all know the limitations what we have in money and material. And next one is time. The timely action or the timely decision only can improve the health problems. So the first one, health manpower. So in health manpower, as I have told, the prescribed or the suggested norms for various health personals we can see here. Like at least 1 doctor for 3,500 population, at least 1 nurse for around 5,000 population, health worker, male and female, at least 1 for 3,000 to 5,000 population. So all these things is given in the table. Even you can follow the textbook also. So even though we have a lack of manpower, health manpower is even less in India, even we are not able to cover in all the areas as per this particular ratio. The next one is money and material. So as I have told, it is a scarce resource in India because we are a developing country which is not very soundly economically, we are not much sound. So we should use it very wisely, we should able to manage it wisely. So focus on maximum output of results so that the investments should be done in the correct areas. Then invest the resources on preventable diseases. Rather than we are spending much money into the in order to bring up the various prestigious medical institutions, we would more focus on the investment of resources on the preventable diseases, like immunization, vaccination. We should be able to focus more, and the cost effectiveness and cost benefit analysis also should be focused in order to wisely use the money and material, so that we will get what should be done and where should be more money allocated. The next one is regarding time. Time is an important dimension of healthcare services. As we all know, the timely decision or the timely action can really help in preventing various health issues. So the administrative delay we can see, like in order to sanction a health project, even sometimes central government they start a health project, but there will be much more delay, even 1 year or 2 year it will take in order to sanction that project from the administrative area and allot the funding. So this delay should be avoided. Then proper use of man hours, like how many working hours, how many night shift, how many day shift, these all should be wisely used. Then only we can see much more management in the time aspect or in the care aspect. Then various research projects also can be done on proper utilization of time. Time എങ്ങനെ കറക്റ്റായിട്ട് നമുക്ക് യൂസ് ചെയ്യാം എന്നുള്ളതിൽ നമുക്ക് ഒരുപാട് റിസർച്ച് പ്രോജക്ട്സും നടത്താനായിട്ട് പറ്റും. സോ ദീസ് ത്രീ ആർ ദ main things you should keep in mind: proper use of manpower, proper use of money and material, and proper use of time. So in order to summarize, we can tell that what is very important is to employ the suitable strategies to get the best out of all the limited resources. നമുക്ക് ലിമിറ്റഡ് ആയിട്ടുള്ള റിസോഴ്സസിനെ വൈസായിട്ട് നമ്മൾ യൂസ് ചെയ്യുമ്പോൾ വിത്ത് പ്രോപ്പർ സ്യൂട്ടബിൾ സ്ട്രാറ്റജീസ് വി വിൽ ഗെറ്റ് ദ ബെസ്റ്റ് റിസൾട്ട് ഔട്ട് ഓഫ് ദാറ്റ് ലിമിറ്റഡ് റിസോഴ്സസ്. ദിസ് ഈസ് വാട്ട് വി ഷുഡ് ഇംപ്ലിമെൻറ്റ് ഇൻ അവർ health sector. Thank you, students.